Empowerment Through Knowledge Publishing and Serena Stone present the Tequila Drinker's Guide to Health and Wellness Radio Hour with your host, author and medical Qigong educator, Serena Stone. Featuring the director of the Universal Healing Tao and author of dozens of books on natural health and longevity, Tao Master Mantak Chia. This show is for all of us who work hard and play hard. Those of us who are willing to try new things to improve their life, and those who will not tolerate victimization as an answer to health and wellness issues. And now, the Tequila Drinker's Guide to Health and Wellness, episode number 10, Man, Boobs, and Chicken Legs, part 2, with Dr. George Yu. Today's episode is part 2 with Dr. George Yu, the expert on hormones and their effect on aging, your body, brain function, and longevity. Dr. Yu gives advice on what to do if you have developed man boobs and chicken legs, and for ladies, seen your waistline disappear.
Today's trivia is from chestsculpting.com and mindbodygreen.com. Fact: man boobs occur when your chest is exposed to a high estrogen to testosterone ratio. This is when you have high levels of the female hormone estrogen and or low levels of the male hormone testosterone. Fact: not only does high estrogen exposure cause men to grow boobs, it also affects the hypothalamus and pituitary gland in the brain, leading to decreased testosterone levels, reduced sperm count, reduced fertility, and reduced libido. Fact: a symptom of hormone imbalance for women can be digestive problems. Gas, bloating, and slow digestion are common hormonal problems that aren't usually associated with hormonal imbalance. Fact: another symptom of hormone imbalance for women is unusual cravings. After eating way more than you should have, or having gone through half a bottle of wine, do you look back and ask yourself, why? Common causes of cravings and excess eating are adrenal fatigue, insulin resistance, and other hormonal imbalances. Fact: many things that increase a woman's chance of developing breast cancer will also increase a man's chance of growing man boobs. All right, today's show is about your hormones. A couple of weeks ago, we learned a lot of men and women are suffering from hormone imbalances. We had our first visit with Dr. Yu. A large number of women are on estrogen, progesterone, or both, and more men are taking testosterone to restore their masculinity and physical health issues. We also learned that synthetic hormones could be damaging, and today we're going to get some answers about hormone therapy and its place in a Taoist lifestyle. Now, I know you guys hear all that background noise. Here we are in Tao Garden in the dining hall, and the people are just starting to come in for lunch, and we're going to hear lots of noise. But, we're happy to be here. Now, today we're going to have our second visit with George Yu. He's a surgeon based out of Annapolis, Maryland, and Washington, D.C. He's been a professor of urology at the George Washington University Medical Center since 1981 and a partner in Aegis Medical and Research Associates for 35 years. Through his surgical experience, he's learned to understand the impact of sex hormones beyond reproduction. And after 35 years of performing pelvic cancer surgery and reconstructive surgery, he's dedicated the remaining part of his career to sharing with the public the importance of sex hormones beyond reproduction. So welcome back, Dr. Yu.
Thank you.
All right, now In part one of our interview, you educated us all on how our hormones may be the cause of ailments, or they could also be a part of great health. I'd like to jump right in and ask you, why don't you advocate synthetic hormones very often?
Well, that was a very obvious answer in that the publication from 2002, the Women's Health Initiative of 16,000 women, showed that using the horse hormone CEE and medroxyprogesterone was not good. I myself didn't know that long before that. I started using that around 1999 for my surgery to soften up the tissues for reconstruction. However, that study clearly showed within 5 years that there was a growing number of women with breast cancer, with cardiovascular disease, and believe it or not, 100% blood clots in their legs. I had known about this because I knew that any kind of synthetic hormones signal to the liver there's something wrong. The liver, you see, metabolizes all hormones and drugs. On the first pass, they would get rid of 90% of it. But when you have a synthetic hormone, it doesn't recognize it quite well. But it doesn't just watch, it creates hormones. Those hormones and proteins will cause problems like blood clots. That's why people who take birth control pills are discouraged to use it if they have a history of blood clots. The difference is that the dose of of birth control pills is at much lower doses now than the initial studies done. My own experience as a surgical resident at Peter Ben Brigham was one of the young women, 29 years old, came in with shortness of breath, and we couldn't find anything, and she died. She died of a massive blood clots to the lungs.
Oh my God.
And in Vanity Fair, just in the issue, I think it was 2004, it showed another case of that using a vaginal birth control pill in which an Olympic potential star died.
Wait a minute, vaginal?
Vaginal, you could use these hormone synthetic ones also vaginally.
Oh.
Just like we use hormones, natural hormones, either topically as a cream, orally as a lollipop, drops. We can use it as a rectal suppository. We use it vaginally. We use injections. We use pellets. So there are many, many approaches. You just have to get it into the system.
Okay, so wait, not all of your therapies that you advocate for men and women are a pill?
Oh, very rarely we use pills because pills, remember, goes into the gut. And when it's in the gut, the small bowel, and before it gets to the large bowel, the portal vein transports a lot of it to the liver, and the liver knocks out most of them by 90%. So the topical creams are fantastic. The vaginal suppository and creams are fantastic. The troches, or what we call lollipops, and drops go right into your bloodstream without going through the liver first.
Oh, okay. I could talk about the liver all day, but I think that would bore our listeners. You have my attention, that's for sure. Before we get into some of the more technical stuff, is there a positive story that you have about any of the people that you've worked with? Something that maybe the men or the women in our audience, maybe we could identify with? What's an optimal situation for
Well, let me give you two simple cases. One is a man who's 93 years old. He was a very successful CFO for a company, and he did well, and little by little he got older. And when I saw him, his memory was starting to fade a little bit, and he was not happy. He still looked pretty good. And I found out his levels of his examination showed it was definitely on the low side, around 300, which is still within the normal limits. But he was losing muscles, obviously. He had chicken legs, and a pot belly, and he didn't like his breast looking a little more prominent. And he was still kind of a vain guy. He was a good-looking fella. And he said he wanted to do something about it. And I said, well, you're kind of old. And he says, no, I'm not old. And I complied after talking with him. And I said, okay, I think, your testicles are pretty much gone. And why don't we try different methods first? And it turned out after a long trial that the pellets were the best for him. And the pellets were inserted under the skin every 4 months, and he became a different person. He had much more energy. He started developing chest muscles. His chicken legs became thicker. He got better looking. His skin got better. And he told me his achiness was gone. But the most important thing to him was that his brain was working in a better way.
Wow.
So now he cuts the lawn for the church. He's retired. He's got nothing else to do. And all the women are looking at him.
Hey.
And he's just a great guy with 2 daughters. And, of course, they love him. But they're so relieved that they don't have to put him into a home in the very near future. So that's case 1.
Wow. That's huge.
We adjusted. And the other one was a very beautiful woman in her 40s who had a beautiful figure, and she loved to have estradiol estrogens. She was already taking it. And I said to her, no, I'm not going to take care of you. You only use estradiol because you have nothing to oppose it.
What does that mean?
That means that the balance between the progesterone to estradiol estrogen has to be just right. Okay. It would be a ratio of around 100 to 200 to 1. And I said, I'm sorry, I won't take care of it. She said, I want you to take care of me. I'll do anything for it. And I put her on the progesterone in addition. And she had one problem when we started the study of her case, and she had dense breasts, very firm, beautiful breasts. But I said, doesn't look good. And you're drinking 2 glasses of wine a night. I said, you need to cut that back because sugar and estradiol will encourage the growth of your breast density, meaning glands and collagen, which is a future risk factor for breast cancer.
Wait a second. I'm going to stop you right there because most women think they want denser breasts.
That's right. And the thing is this. Yes, it pouts out and looks quite nice, but it's no fun to get breast cancer. So what I tell the women when we put them on a small dose of topical progesterone, they say, oh, my breasts are getting softer and I don't feel the lumps anymore, but I don't have the pain on menstruation either. And I said, well, that's because the densities are gone. And we checked the x-rays and bang, no more. Okay? So
let's go back to this lady.
Okay, so after 1 year, I said, this is it. If you don't comply, I'm going to make sure that I'm going to have to do something about you. And she had her mammography, and to our great relief, about 85% of her density was gone.
Wow.
So that left a huge impression on me that I could take care of these women who are adamant about using estradiol because their memory, they need to do it. They function in a very active life. But by balancing the topical and oral progesterone to her and getting it in the right proportion physiologically and therapeutically, I was able to continue taking care of her. And she now has very little chance of developing the higher risk category.
Jeez, that's just huge. All right, I'm going to ask a really surface kind of question here. Because I thought I heard you say something about the 93-year-old guy had an improvement in his skin.
Yes. What's very interesting is this, and very few textbooks write about this, but I noticed that the men who have hypothyroidism and low testosterone, when we give them the replacement physiologically, their skin gets better. They're better looking. And of course, for women, it's very obvious because I've had many cosmetic companies come to me and ask me if they could use a formula that would be acceptable. And I tell them, no, these are prescription medications. You know.
Well, I mean, you even got my attention. I'm a female over 50.
So,
and
so
you
it's
said
very.
skin.
So one thing that's interesting is even our oldest patients. You know, some of the older women in their late 70s and even 80s will say to me, "Doctor, please, before we end this conversation, I need the topical facial cream before I go." They're not interested in all the other things, but they
Yeah.
want the facial cream,
Yeah.
which is a prescription, and there's no question if they look very good.
Oh boy. All right, we're going to talk about that one in private. Let's ask a question for the guys. Does testosterone have anything to do with diabetes? And of course, I'm asking that question because I heard you mention this the other day.
Okay, before I start that,
Oh.
I want to make it clear. I would never get involved in this if it caused a cancer. And I, being a urological cancer surgeon, felt that I had to really understand if testosterone caused prostate cancer. It does not. The Rodman, no, it does not. The Rodman study of over 8,000 men showed no clear correlation. The Valentine Carter study, longitudinal, now this is not cross-sectional study, they looked at longitudinal, watching all these men historically from their blood tests. Did it lead to prostate cancer? It did not. There are many controversies, and among my colleagues, there's still controversies. But in my mind, it became clear that after Abe Morgan-Taylor and A. Trish published a lot of work showing that replacing hormones did not show an increased incidence in prostate cancer, then it led the way for me to fully go after this. Molly Shores showed evidence that the testosterone and the lack of showed a higher mortality rate. Okay?
Okay.
Okay, so what about diabetes? Basaria, who was at Hopkins and who's at Harvard now, published a topic on men who were castrated and what happened to them afterwards. And he called this an inconvenient truth. Well, what happened was what I saw in 1978 as I took care of all these men, they became diabetics.
I just don't get it.
So there's a relationship in testosterone affecting what we call scientifically the glucose disposal rate. In other words, how much sugar in your blood will go into the cells. And this is well studied. This is one of the standard testing we use for drugs for diabetes. And if you don't have testosterone, one of the papers I wrote with Trish in 2011 showed that within the cell of the heart, of the smooth muscle of the penis, and I'd like to show one of the prostate cancer, if you castrated them, there was a mitochondrial energy disruption. In other words, the mitochondria is responsible for fuel generation.
Yeah.
Mass to fuel, energy. And that was disrupted in some way. The mitochondria and ellipsoid ellipsoid organelle in your cell has its own mitochondria, and it's the energy producing packet. And that swells up, and there's vacuoles all around it. And when you give the testosterone back, it returned back to normal. This was shown by Jan Torp, Sweden, 20 years after I saw it the first time. And the tree showed it in electron microscopy. So we know that something's happening to these people. But what Basaria showed was clinically, in his clinic, he showed that men had first insulin resistance, higher insulin levels, higher glucose level at 6 months, and at 1 year, many of them became diabetics.
Okay, and so this was after a procedure?
Yes, if they got castrated for prostate cancer.
Okay.
It exists today. Okay, so what I'm saying is that there's a double-edged sword in castrating people for the prostate cancer.
Yeah.
So I've always pushed for intermittent androgen deprivation, just like the Canadians do, and let them come back to their self and then do it again. I've had one doctor who's been with me for 18 years doing that. You see, The hormonal disruption definitely stops the prostate cancer, but that doesn't cure it. But it does everything else to all your cells.
Right. Oh, well, yeah.
So that's
That's
the
huge.
most important thing, but that's all related to the relationship between testosterone hormone and other hormones, of course, to metabolism.
I was just going to say, let's say we're talking to an audience that hasn't had to go through the process of castration. Is there a concern for the men in our lives if as their testosterone level drops for their ability to process glucose?
Absolutely, it's well shown already. Some of the best studies was done by Pete Loud at Mass General at Harvard, who showed this, that their glucose level was abnormal and their hemoglobin A1C was abnormal. And we showed it in electron microscopy that there's changes. There was a publication by Wang, I think 2 years ago, showing that the mitochondria of the heart cells changed when you castrated some in animal studies.
So some of our Western doctors are not so crazy now as they're starting to suggest or prescribe more and more testosterone therapies for men with all kinds of problems.
Well, there's, it's like anything. It takes a while for the momentum to come. As I said to most of our patients, there's a scientific discovery. It takes 15 years before it becomes applied in clinical medicine.
Okay.
So there's a lag time, and people have to take their time and accept it. Not everybody's going to be a forefront runner, neither am I. And the thing is, you have to let this mature, but we know it. So for our patients, we say we don't want to wait 15 years. You might be dead by then. So we start when we see that there's good evidence scientifically. We don't wait for consensus to occur, because consensus is, there's a lot of other agendas, like economic, political. It's like the food pyramid. It's a consensus of many agendas and interest groups.
Well, I'm excited to see where we're at 15 years from now. Actually, the research has been going on more than that.
Yeah.
Now, I've heard you say thyroid function. Now, guys and gals out there, thyroid is one of your glands. I've heard the doctor here say that thyroid function is related to sex hormones.
Yes.
And I think everybody wants to know, what are you talking about here?
So let me say that more women have clinical hypothyroidism that may not be always confirmed by lab studies. Okay, so when I was an intern, I remember my chief resident said to me, "You're admitting this gal who's pregnant. She's on thyroid medications and she has pneumonia. I want you to double her dose of thyroid." And at that time, I didn't understand it. Of course, I didn't do it. Okay. And the next day, I was called on the carpet and said, "You're supposed to do that." And then I started reading all about it, and I realized that estradiol, estrogen, affects the viability of thyroid hormone. So, in other words, if your estrogen's too high and your progesterone too low, more than likely you will have some kind of dysfunction of your thyroid. So
that's bad. Ladies and gentlemen, this is the thing that can make you fat, okay? Among other things.
Yeah. I mean, the thyroid is basically an incinerator. It's what we define as your basal metabolic rate. In other words, we as mammals, not fish, can only stand a very slight change in temperatures. If we're at 95, we're pretty much close shop. If you're 103, you're going to die if you stay at that level. So the optimal level is somewhere around 97.8, 9, and 98. But if you're under 97.4, before you move, as soon as you wake up, you know you have some problems with your basal metabolic rate, which is largely governed by the furnace of the thyroid. So it's a very important hormone. And that also gives you energy, and that also triggers the use of energy so you don't get fat. And so one of the things, I'm not saying thyroid, you should use thyroid to treat obesity.
Of course.
I'm saying that there's something wrong, and it's influenced by the sex hormones. See, that's what a lot of endocrinologists, they were trained to only think thyroid is thyroid, diabetes, thyroid, but very few understand that there's a relationship between the sex hormones and thyroid. To give you an example, of why experience is so important. And I quote Janet Travell, who was one of the greatest physicians in the United States, and she wrote a textbook at age 81, and I asked her why, and she said, well, I just want to make sure it was really correct. So experience is everything.
Yeah.
So I had a young lady who had thyroid cancer, and she got a thyroidectomy, and within 2 months she was menopausal. Just the reverse. So these hormones affect each other. Now I'm talking about estrogen affecting the thyroid, but the thyroid also affects the estrogen. So when I saw that, I was just flabbergasted, and I thought about her case for a very long time and began to understand it. But when you go through menopause, as I said, the estradiol, of course, plummets, but the progesterone plummets more. So now you're estrogen dominant. Okay, so even though they're both dropping, one is higher than the other. And that leads to a situation where you're more prone to injure the thyroid.
Well, all right. I'm going to ask you one last question before we go. You know, we both live in America. I am in Minnesota, surrounded by Native Americans. Is it natural to use the resources that we have to shift our body like this? Is it okay to play with our hormones, I guess?
Well, it's a very, very good question. So when I speak to an audience, sometimes 1,000 people, there's always some person in the back who raises their timid hand at the end and said, it was a very nice talk, Dr. Yu, but, and they were Catholic, and they said, well, if God felt that this should be, shouldn't it be that way? And I answered a very simple question. I said, God wants you to do well, but he did not realize that you would have food forever, that you would have electric blankets and heat and a house and clothes. Therefore, now you have technically changed the life cycles to a longer period of 90 years or longer, which is basically 3 times your reproductive age.
Yeah, it
from
is.
30 on. So evolution of hormones change very slowly. In fact, Baker and Associates showed that hormones change every 500 million years. So it cannot catch up. So now you're living longer, but the hormones have pretty much said sayonara. It's gone. So now do you want to live in pain?
No.
So my thought is a practical solution, and I'm saying practical, is to use the safest natural human identical hormones to correct some of the deterioration of the factors that are affected by hormones.
I love that answer. All right, folks, we could talk to Dr. Yu forever, but I think he'd like to have some lunch now. So, again, I have this feeling that this work is going to become a part of the Universal Healing Tao system. And someday, listeners, you're going to be able to go to the website and get more information. But for our website at Universal Tao. But for now, Dr. Yu, how would you like people to learn more about this?
I think you should read some important books. For men, the Testosterone Syndrome by Shippen, or Morgan Taylor's book on testosterone. This is a book that for women should be What Doctors May Not Tell You About Menopause by John Lee. And you should also use Catherine Rollins and Australia's website for women. And you could look up zrt.com. They're excellent information, and there's references. You can look at our website, which is limited, but a lot of people get a lot of benefit. TotallyYU.com. TotallyYU.com. That's 2 Y's in there. And you can learn about it. And there are quite a number of practitioners worldwide who use it, who use natural hormones, and I believe very strongly that we should not be using synthetic hormones in most menopausal, andropausal cases. There are certain cases where synthetic hormones are useful, like prednisone, which is a long-acting cortisone, but you know that there are side effects. So I would say if you could keep your health well and do prevention, the secondary prevention is to intervene because you're living too long, and that you need to address the hormones as an important factor in your whole body functions.
Well, all right, folks, you heard it here, www.totallyu, spelled Y-U.com. Dr. Yu, thank you so much. I think you've opened up a big door for a lot of people.
Thank you for the interview.
All right, folks, we'll see you next week. Bye.
Thank you for joining us on another Empowerment Through Knowledge adventure. Want to learn more? Find Master Chia at mantakchia.com. That's mantakchia.com. Find advanced learning materials, books, and more at serenastone.com. That's SarinasTone.com. Thanks for listening, and if you like what you heard, please subscribe today. This podcast was produced by J.C. Warfield Productions in conjunction with the Echo Chamber Studio, Minneapolis, Minnesota.